how your body moves. So you mentioned you have a little bit of a scoliosis.
I do, yeah.
And a leg length difference that you know about.
Yep, right leg is shorter.
And you've tried chiropractic.
Oh, lots, yeah.
Tried the
Years
ablation.
and years and years of chiropractic.
Injections.
Yeah.
What helps? What doesn't help?
About 5 Advil.
Yeah, takes the edge off, yeah. What would you like me to do?
So we're gonna take a look at the way you move.
Okay.
Stand facing away from me here, and I'd like you to just bend forward, reaching toward the ground, and we'll take a look at how things move. Let me know how it feels. Yep.
Go all
As far as you feel comfortable.
all right, well.
No need to bring on excruciating pain.
Well, that, just to be honest with you, that all hurts right there.
Yeah. And come on back up. Where are you feeling the pain?
From about the middle of my back to my hips, all down through here in my hips.
Sure.
So.
How does backward bending feel? Put your hands on your hips.
Hurts.
You can stop there.
Okay.
In the same area?
Yeah.
Pretty stiff and restricted through there.
There you go.
Some of the motion limited by pain.
Mm-hmm.
And what kinds of activities? You said you are pretty active with work.
Yeah. That's about it. I mean,
That keeps you busy.
Oh yeah, right. Yeah, for sure. But yeah, I like, snowmobiling. I know I haven't done that for years, and just because.
Right.
Yeah. So.
What would you need to do?
Snowmobiling. Snowmobiling. So. Winter sport, I guess, is what I was getting at. So.
So what I'd like to do is a little bit of assessment. See if we can bring this out to the side a little bit. Let's see what's there. That should be good. I'd like to take a look. What positions are most comfortable for you? Are you comfortable laying on your back?
I can do that, sure.
Sure.
Yeah.
I'm gonna grab a pillow for you.
All right. Shoes on, shoes off, doesn't matter.
Oh, whatever's comfortable for you. It doesn't matter. We'll clean the table.
All right, that's what I was asking.
That's just fine by me.
That's how my mother taught me. So
You may want to scoot up a little bit.
This
Just
way?
your neck's a little supported. Yeah. You said you have all those things. Do you have pain in the hip joints as well, or does it seem to be mostly?
I mean, like right now, it's not bad. But if I walk, like let's say from here to, Leonard's Point Road,
Okay.
it would be like on fire.
Okay.
Yeah.
And is one side worse than the other?
It kind of it'll switch.
Okay.
Lately, here for the last 3 months, my right side has really been, firing down
Okay.
sciatic and.
How far down does it go?
Like
Buttock, back of the thigh, calf,
it'll make the
foot.
bottom of my pad of my foot even
Okay.
hurt
I'll
or
put it
tingly,
Sure.
Yeah.
I'm just gonna take a little peek at how your legs
Sure.
move, your hips
Yep.
move.
Yep.
Let me know if anything hurts.
No,
Just allow me
just-
to move you.
Yep. Just.
I'm stronger than I look.
All right. Wonderful.
Any bother as I bring your hip up there?
Yeah, it starts
Start to
to.
feel it on that side.
Yep.
So test your rotation. Fairly decent mobility and rotation.
All right.
Any bother as I'm moving the hip either of those two directions?
No,
Okay.
just that first
The
one.
flexion.
Yeah.
Yeah. We'll test out the other side. Same thing. Let me know
Sure.
if it hurts.
Let me just relax.
Just
you
relax.
All right.
Yep. Relax and let me know if it bothers. To get the end range.
Yeah.
Where is it? And
On this side.
on that side.
Yeah, mostly kind of from the middle out to
Okay.
that way. Yeah.
Any bother there?
Mhm.
I think a lot of your back pain seems to be coming from lower low
Right.
back,
Yeah,
more so than a hip mobility restriction.
could be, right.
But definitely a higher ability when we flex and extend your
Right.
back. So what I'd like to do is some joint mobilization to your back. We'll do that from a sitting position today.
All right,
If you want to roll over and sit on up.
roll this way, all right.
And get something to lean forward on. Self stool and a chair to lean
Dr. Jessica,
forward
I think
on.
that could level that table out, so have him stand. Because it's I think when you're trying to move it, lift it up a little bit on the foot end of it. I don't want him sitting. Can you want
Want to
this?
stand up?
Oh,
Yeah. Have him sit up and then level that low leg.
Is this part.
Okay. Maybe I didn't see that
Is
right.
that okay?
Sorry about that. Yeah.
Better safe than sorry.
Right,
So have a seat right here
okay,
and let you lean forward a touch here. Maybe a little low. That might be a little better. Here we go. Comfortable height. Why don't you just lean forward with your
Okay.
elbows supported there.
okay,
Just at a comfortable lean. It doesn't need to be a huge lean. Alright, so I'm going to give a little bit of pressure throughout the back.
okay.
Let me know if anything is tender. What are you feeling there?
Nothing.
Just pressure.
Yeah,
So I give pressure out this way. Anything tender?
nothing,
Nothing to complain about?
no,
Does it feel neutral, aggravating, relieving?
slight aggravating, I guess.
Okay.
You know, and it's probably not even so much just you're pushing, just actually just leaning forward right in the middle of, you know, just trying to stretch.
The leaning forward
Yeah,
movement?
yeah.
So come and sit up a little bit taller.
Okay,
Is that less aggravating?
a little bit.
Okay. We don't ever want to use a treatment position that aggravates you more than the treatment helps.
Okay, all right.
So if things are bothersome, I want to know. So when you have your pain, is it mostly in the low back?
Yep.
Does it come all the way up?
It'll be low back and then,
Down into the
yeah,
glutes?
I gotta, when you just go up on the right hand side, right, just keep on going up, right, keep going up. Right about there, I got a rib that's actually dislocated, it's forward.
Okay.
So actually up a little bit from that, right, about there.
Okay. Does that give you a lot of pain?
It'll let me know, yeah,
Intense.
yeah. I mean, it's actually, you can, you know, it's sticking out the front probably that far.
Okay. How did that happen? Random?
Random, yeah. Pushing and pulling on something.
How's that pressure feel? Neutral?
Neutral, yeah.
Okay.
Worked, you know, a lot with the chiropractor trying to get it back, and it's there.
Right in that mid
Right there, yeah.
region. Yeah.
Mhm. Can you feel it?
little bit different on that side than the other side.
Yeah.
Yeah. There's just some global stiffness throughout your thoracic and lumbar spine. Your spine probably hasn't been accessing full mobility in response to the pain you've been having, and that results in it being even stiffer.
Okay.
How's that pressure?
Fine. That's good.
Good. So, is there anything work-wise that this has stopped you from doing? Or have you pushed through the things you need to do?
Yeah, just push through and, yeah.
Try to ignore it, try to mask it,
Yeah,
try
yeah.
to solve it without any luck.
Right, right. Picking up something heavy really, hurts the lower back. Bites into really bad.
Okay. How are you doing with that pressure?
Oh, fine.
Good. I want it to feel neutral or relieving, not aggravating.
Okay.
Just kind of getting the joints moving, and it shouldn't hurt.
No, so with that little bit of, I'm
So
saying.
joint mobilization.
Okay.
It might feel like a massage, but it's a little bit different.
Okay.
We're getting the joints moving.
Okay.
Joints that maybe aren't used to accessing that full range of motion.
Okay.
And we're giving them extra input to kind of calm down those surrounding nerves, get things feeling better, calm down the muscles surrounding the back
Okay.
so that they aren't hypersensitive. So what I'd like to do is take a look at how your bending feels just with that couple minutes of work.
Okay.
A full treatment would be much longer, more extensive than that, but with just a couple minutes, I guess that we can start to make a little bit of change in
Okay.
quality of movement. Let's see it.
Is that better?
Back up. That's a little different.
Okay.
Quality of movement, definitely.
Well, can you tell the difference?
Easier. Let's see your backward. We don't expect 100% in 5 minutes.
I know, yeah, right.
But if we see that much change in 5 minutes, we expect that with a plan of care, we would see a lot more change,
Okay,
right?
sure.
It's a starting point,
Sure.
and it's a sign that if we can create a little bit of change in 5 minutes, we can create a lot of change by addressing all of the components that are contributing to it.
Sure.
So, thanks for
Yay.
volunteering.
Thank you. Thank
Have
you.
a seat.